Well, welcome. Thank you for coming back again. It's the update today on the global position with the COVID-19 pandemic for Monday, the 13th of April. Now, let's start off with some figures. So this is the official number of confirmed cases globally. This is the official number of deaths. Again, we know they're way higher than this. But sobering to note that even the official number of cases is heading towards the 2 million mark. Now, the United States, well over 500,000 confirmed cases. The testing is improving in the United States, but obviously it's not where we need it to be. And the deaths are also increasing in the United States. And I'm not going to go over these in detail now. We've already looked at some of the appalling situations as regarding these increasing deaths in the United States. But what is overall concerning is the total number of deaths in the United States is relatively high. So we've got 62 deaths per million people, according to one American news outlet that I looked at, which is higher than other countries. So that is concerning. But the mitigation measures in the United States are starting to work and new cases are easing to some extent. So if we look at this, if we look at the right graph, that one, yeah. If we look at this graph, for example, this is just an internet graph, but it does show the number of new cases. So we see there's still a lot of new cases per day, over 30,000 new cases in the day, but the rate of increase is levelling off, which is encouraging. So this was the rate of increase. Now, it's quite reasonable to assume that without the mitigation measures, this would have simply carried on increasing. But with the mitigation measures, it looks like we're starting to get this levelling out now. So let's hope that that is going to continue on a downward trajectory. So that is looking reasonably promising. Now, having said that, sorry, that is a picture for the end. That's Catherine and John and his family. I will learn to click the right things eventually. Yeah. So because of this lag effect, the deaths are still increasing in the United States and may do so for some time, because of course the deaths can occur 1, 2, typically 2 or 3, but can be 4 or 5 weeks after the onset of symptoms. So we can expect more deaths to occur in the United States at an increasing rate for a period of time, but then I would expect the death rate to follow this reducing curve, albeit with a delay of several weeks. Hopefully 1 or 2 weeks, but probably 2 or 3 weeks lag, unfortunately. Now, I'm doing some more studies on this vitamin D situation in the States. Now, I know you're sick of hearing me talking about this, but a study I've got from Healthline, which is a reputable website, based on other studies, has said about 42% of the US population is vitamin D deficient. Now, we know vitamin D is involved in immunity. That's not a debate. So it's more than reasonable to assume that the immunity levels in the United States are less good than they would be. Immunity is compromised in the United States because so many people are lacking vitamin D. And we also know as a simple scientific fact that darker coloured skin produces vitamin D in the sunshine more slowly, and most vitamin D comes from the sun. So this rate, 42%, is 82% in African Americans. So black people, 82% of them are deficient in vitamin D. This is a lot of our people that are deficient in vitamin D. And in Hispanics, it's 70%. Even though the skin is only slightly darker, it's sufficient to mean that less vitamin D is produced. That combined with lifestyle. So it's really concerned me in the United States that this increased death rate in darker skinned people has been observed. And very often people jump to socio-economic explanations. Now, I'm not saying they're not there. I believe they are there. But why this is not being addressed is bemusing to me. I've never heard this mentioned by any official in the United States, and yet it would be so easy to correct. But it doesn't seem to be being done. I am preparing a separate research-based video on that, so keep an eye out for more detail on that. Now, Canada, the situation in Canada. Quebec's turning out to be a bit of an epicenter, 240 deaths there. 31 deaths from a particular care home in Quebec. That was very disturbing, and I believe there is circumstances there that the police are looking into. But more generally, this is a problem globally. We know this. In care home facilities, people living together and the most vulnerable individuals. Now, in Ontario, for example, 100 outbreaks in care homes. This is just huge, a huge problem. And we will see one possible solution to that when we look at the United Kingdom later on in this video. Basically, I'm not going to make you watch the whole video. The bottom line is that there's a dozen people actually moved into the care home, a dozen staff, who aren't going out and they're just staying there. They're living in the care home with their vulnerable residents. So that was a great thing to do, and that probably is part of the way ahead. As those people demonstrate quite a lot of commitment, well, a huge amount of commitment and self-sacrifice. Now, this encouraged me. Alberta is sharing equipment, PPE and other equipment, with other provinces because there's less cases, thankfully, in Alberta. Most of the cases are on the east coast. We know there's quite a few in British Columbia as well. And it just struck me that this was in such stark contrast to the United States of America, where states don't seem to be cooperating with each other. I don't know the full situation there. That's an impression as an outsider. If you're in the States, you'll know much better than me. But glad to see that Alberta is sharing with other states, and there seems to be more interstate cooperation in Canada. And 3 Air Canada 777s have been kitted out for cargo. There are some videos of these 777, Boeing 777s, I think they are. And they're absolutely huge inside when you take the seats out, so they can carry a lot of cargo. So that's encouraging that they're going to start shipping vital equipment, PPE, ventilators, medical equipment, presumably drugs, around to different provinces in Canada which are more in need. We need much more of this cooperative approach. Now, I mentioned South Korea today for a very concerning reason. We'll see it in a minute, but let's just notice what's going on first of all. Now, all arrivals from the United States are being tested in South Korea, like every single one. And that's before they go into quarantine, of course. Because what South Korea have found, and these are people that are travelling from the United States, presumably on business, that have to have a good reason to travel in this current climate. So these are people from presumably middle-class occupations in the United States. And 228 out of the 459 cases re-imported or imported into South Korea are from the United States. Now, I'm not saying that these people from the United States are a representative sample of the United States, that they won't be, but it is showing there's an awful lot of people from the United States arriving in South Korea who are infected, indicating to me that it's quite probable that the number of infected cases in the United States is way higher than we currently believe. So it could be well over the 500,000 mark infected, mostly due to community transmission in the United States. So that was quite concerning for two reasons. First, the international travel still spreading cases around. Secondly, the fact that it indicates there's probably quite a lot of cases in the United States. So of 25 new cases I think this was probably Saturday, 25 new cases, 16 were imported. That's on one day. Now, this is, well, I'm not going to put too fine a point on it. This is alarming. Now, what the South Korean government is saying is that 116 people who have been diagnosed with COVID-19 and recovered have been tested positive again. Now, the obvious question mark here is, does this mean that a proportion of people who have had COVID-19 are not developing immunity? Because normally, as we've said many times, the antigen, which is the virus, causes the human body, the human immune system, to produce antibodies, which are the immune proteins which we would expect to confer immunity, perhaps for a year or two or more, probably around about 18 months, based on other similar type of viruses. Now, on the face of it, this looks bad. My current belief and understanding is that still people who've had the disease will develop antibodies, and the vast majority of those will be immune for a period of time, or highly resistant to getting the disease for a period of time. So I still believe that. So how do we explain this? Is it faulty tests? Well, that's possible. People could have been given false positive results. That's possible, but false negative results are probably more likely in this testing. So that's not too likely, and the South Korean testing quality is good, no question about that. Reactivation of the virus, in other words, has the virus lain dormant in the body for a period of time? That's possible. For example, that happens with people who've got shingles. The virus, the herpes zoster virus from the chickenpox, can be reactivated and causes shingles. Or is the virus mutating? That will probably be the most concerning explanation. But given that we're dealing with relatively small numbers here, I think it's a bit too early to say. But it is certainly concerning. Is this going to turn out to be a big trend? I suspect not. Is this going to involve a minority of people who've had the disease that they could be reinfected? That's possible. But what's quite going on there yet, we don't know. So we wait for more data on that from South Korea. And I think it's fair to say I wait with a degree of anxiety about that, because that is, if that's confirmed, that is certainly very concerning. Now, China. We know this is a massive underestimate. I'm not going to debate the China figures. We know there's been inaccurate reporting from China. My government, the United States, have cast doubt on the China figures. But there's no doubt they have largely contained the pandemic due to their measures either. So the fear in China now is a second wave. Now, what they have in China is they have this digital health app. So this is an app that's on the mobile phone. So you have everyone has to have a mobile phone to go out, as far as I can gather. And you have like a health passport. So you've got to download this app. Then you have this health passport. And you're either red, amber or green. So what the phone does is it relates where you've been to where other known cases are, and then says, "Oi, John might have been in contact with other cases. He goes red for a fortnight, and that would restrict my travel." Or it's John hasn't been anywhere near other cases for a few weeks. He gets a green, so he can travel a bit more. So we have this. There must be this massive database in China where all of the cases in the country are collated. And that's constantly comparing each individual's mobile phone to that overall database. And that is largely what has allowed this digital monitoring, is largely what has allowed the lifting of the lockdown that we are partly seeing in many, many areas of China now. So I make no inference for the Western world on that, but it does seem to be working in China. So that's one people are going to have to be thinking about. And already in my country, there are voluntary apps that you can download to give your symptoms of COVID-19 if you're suffering from the disease, which I would encourage people to do, because it means we can collect megadata, which is always helpful. 108 new cases in China. Again, this is probably Saturday or Sunday, I'm not sure. 98 of those imported. So most of the cases in China are now being imported. Now, the northeast of China, it's not an area I'm familiar with, but it borders with Russia. Now, there's a lot of cases in that area, and they seem to be coming in from Russia. So Russians seem to be crossing the border into northeast China, and let's say two things. Russians are crossing the border from Russia into China, and there is a new mini epicenter in the northeast of China. The degree to which those two things are related, I'm not sure, but they do seem to be related. So the Chinese certainly think they are, and they've closed the border between Russia and China. And they've imposed a strict lockdown in that area, just in that particular area. Put 28 days quarantine on individuals that are at risk. Note, not 14 days, 28 days quarantine. Interesting extension of quarantine there in China. And they've also found in this area 61 new infections from testing. So they found 61 new infections from people that were asymptomatic, they had no symptoms, or people who were pre-symptomatic. Now, what they know is they tested people and they had no symptoms. Does this mean that they are not going to develop symptoms, in which case they would be asymptomatic? That's possible. Perhaps more likely, for many of them, they would be incubating the virus and go on to develop symptoms in the future. They were pre-symptomatic. Either way, it means people that are feeling absolutely fine can spread the virus, which of course is why we have the pandemic we have largely. So there's mandatory testing for people coming in from Russia now. So again, because these are travellers from Russia, that indicates to me there could be many more cases than are recognised in Russia, unfortunately. So more cases in the United States than are believed, and probably many more cases in Russia than are believed. And in the case of Russia, probably many, many more cases, unfortunately. Starting to cause a problem in China. Now, Australia is doing remarkably well. Confirmed cases, deaths, I mean, it's still terrible, but, compared to other countries. Recovered, and testing is pretty good in Australia. Even per capita is good, and 1.8% of people tested have come out positive, but of course the people that are testing are more likely to be symptomatic. So interesting. Now, there are lockdowns in Australia, but what's been concerning over the bank holiday weekend is seeing so many people trying to go to the beach, and indeed many succeeding going to the beach, who aren't obeying the lockdown measures. But despite this is the graph from the Australian government website in the number of cases, number of reported daily cases. So we see that the number of cases rose, as has been the case in many countries, but now we see that the number of new cases in Australia has fallen off, really quite a little bit of levelling off lately, but it's fallen off quite dramatically. So Australia are getting many less new cases. And let's hope the Australian authorities can get that further down, hopefully to zero, pretty soon. So the number of new cases in Australia is going down quite dramatically. And of course, without getting too boring, Australians do make a lot of vitamin D from the sun. It's a very sunny country. So it's consistent with this hypothesis. So could it be that because Australians get some sun on the beach, they produce lots of vitamin D, and there's a greater degree of immunity enjoyed by the Australian citizens that's not enjoyed by the citizens, for example, in my country or in the north of the United States, or indeed in Canada. Interesting. Now, the current hospitalisations in Australia are also still within capacity. So New South Wales is the highest, 78 hospitalisations, of which 30 are in intensive care. Victoria, 44 hospitalisations, of which 15 are in intensive care. Western Australia, 39, 12 in intensive care. Queensland, 28, 12 in intensive care. Northern Territory is 24 with none in intensive care. So that's good. South Australia, 15 with 7 in intensive care. So compared to other countries, this is remarkably encouraging in the Australia situation. It's far too easy to ease off measures, of course. This has mostly been brought down by social isolation. But you have to say it's been brought down by testing as well, and perhaps also being brought down by the immunity enjoyed all over by people having good levels of vitamin D very often in Australia because it's a nice sunny place. And of course Australia are coming to the end of their summer now. It's coming up to autumn in Australia now, so they've had their sunny period. So interesting. Deaths in Australia following pretty well the pattern that's expected. Male deaths more than female deaths in 50 to 59 in every age group. Yeah, pretty well the same in the older age group. The deaths are lower in the older age group because there's less people in the older age group because they probably died of something else a few years ago. So the death and no deaths in the younger age groups in Australia, which is very encouraging. So deaths in Australia kind of as per what would be expected, really. And the numbers, although each death is a tragedy, the numbers are relatively low. So definite signs of encouragement there in Australia. Now Russia, as we've just looked at, 2,500 new cases, but of course these are mostly diagnosed by testing. I suppose some are clinical as well, giving rise to a total of 18,328 cases in Russia. Is this an underestimate? Of course. How big an underestimate is it? We don't know. But the number of people going from Russia to China that are turning out to be infected would indicate that this is way higher in Russia. Is that an underestimate of deaths? Of course. Are there health provision challenges in Russia? Massive. So when the pandemic does increase in Russia, let's hope it's very slowly. Let's hope they can increase healthcare provisions, but I'm not optimistic. And that will result in an increased case fatality rate as people have difficulty accessing healthcare. Now, Italy, 20,000 deaths, dear me. 150,000 cases, 8-week lockdown. Looks like it's being extended to the 3rd of May now. So a lot of demand being made by from the Italian people there. They're looking at socially separated workplaces now, which I believe is potentially possible. And Bocelli sang outside Milan Cathedral to a deserted square on YouTube. I personally found it moving. If you want to look it up on YouTube, that was I personally found it quite poignant. One man singing outside a deserted cathedral to a deserted square. Spain, again, we know the number of increasing cases are going down in Spain. The deaths are going down, but of course, I think this was the Friday or Saturday figure. The data tends to be a bit out of date over the weekend, but it's still an extra 517 deaths in the day. Now it's down from what it was, but it still means that this total number of deaths is constantly going up in Spain. And some people are starting to go back to work. But the level of public understanding in Spain now is very high, so that does give signs of encouragement. Now France, again, lots of cases, lots of deaths. 4 weeks into lockdown. Looks like they're extending the lockdown now. And I saw videos of Easter Sunday on Paris. Breaches of people out on the street, and the streets look quite busy. Firstly, I'm surprised they got away with it because things in France are normally tightly controlled. And the fact that so many Parisians would decide to go out shopping on Sunday afternoon in the middle of a pandemic is, well, what is it? Disappointing, tragic, it's going to kill people, Iran. Opening low-risk businesses, very worried about Iran. We did talk to the medical scientist yesterday from Iraq. Do watch that video if you didn't see it. And she's very concerned about Iran. Just to finish off with the UK. Increasing cases, increasing deaths. And anecdotally, locally, it looks like deaths are up to about 50% higher than they normally are this week in my area. Now, St David's care facility, this is what I was talking about before, in Forfar, I believe, in Scotland. There's a dozen staff, the dedicated dozen. And what they've done is they've moved into the care home where they look after their vulnerable residents, and they just close the doors. So there's the residents, and this dozen staff have just moved in and they're living there full time, 24/7 with the residents. Amazing level of commitment. So my congratulations to the staff there. And of course, this will work. This in theory, this will work perfectly because the facility's closed off. The reason that you get so much spread in care facilities is that you've got people going in and out, workers coming in, spreading the virus, then the virus is able to spread easily inside the facility. So people living in the facility and sealing off the facility completely will work. It's very impressive. And just another good news story, bombing bikers in Cornwall. So a group of motorcycle enthusiasts have got together and they're delivering food and drugs all around the county to vulnerable people. So that's good. Now, this thing about the deaths in England got me thinking a bit. So I looked on the Office for National Statistics for England and Wales. The Scottish one's different. Now, the last data from the Office for National Statistics is for the week ending the 27th of March. So we're pretty well 3 weeks out of date. But there was 11,141 deaths in England and Wales in that week. So the week up to the 27th of March. That's a 496 increase on the week before. And it's 1,011 more than the 5-year average for the same week. So it looks like deaths in that week are up about 10%, which could well be explained by the COVID-19. But given that's 3 weeks ago, I suspect we've got something like an excess of plus 30% of deaths now. Because these deaths in the UK, unlike the deaths in France, are only in hospital deaths. That's all. No community deaths, not people dying at home. And this figure does not include deaths in care facilities. And we know there's been a lot already. So we know this death rate is a great underestimate. How much of an underestimate? We don't know. Probably 30-40% by now, but that's pure speculation. But that could carry on going up over the next week or two. So although new cases in the UK are increasing, deaths are decreasing. New cases in the UK are not going up. They're starting to reduce slightly, but the deaths are still going up because of this lag effect. And in this period, the week up to the week ending, so the 7 days up to the 27th of March, that's the 20th to the 27th of March, 539 death certificates mentioned COVID-19. Again, that will go up, partly because there's going to be more COVID-19 related deaths, and partly because there's increased awareness and an increased index of suspicion to COVID-19 related deaths. So that was quite a long review today, but you'll notice what I haven't mentioned today is the problems in poorer countries in Africa, India, Philippines, Indonesia. It continues to be a huge concern. Unfortunately, we will see more cases in these areas and many associated deaths, unfortunately. Deaths in the United States still going up, but the case is starting to come under control with the lockdown measures. How sustainable that is difficult to say. You're going to need huge amounts of testing, and societies are going to have to decide if they want electronic health passports to help ease the lockdown measures. I'll leave that one with you. Now, the picture I showed you in error before was to finish with. This is Catherine and her family. I think husband John, I imagine, took the picture. And it's just a great picture. Lovely scenery in Canada. But great to see that people are being reminded, even in this beautiful scenic spot, of the requirement for 2 meters distance to maintain our existence. 6 feet asunder or 6 feet under. So thank you very much for that. Lovely picture, Catherine.